Sabah khair, good morning. Hope you all had a good weekend. Welcome to another week. All right, so back to the international patient safety goals. I'll do a very short video on the goal number 5. Okay, should you wish to read the policy on your own, that's the policy number. You can access the policy on DMS. It's a very short policy. And the policy is about critical results of diagnostic tests. All right, so this policy, it talks a lot about laboratory results. For us down here in radiology and nuclear medicine, it's going to concern a lot the radiologists when they are reporting their critical findings on their reports and the time frames in which they need to deliver these results to the referrer. Okay, so the goals of this policy, all right, is to it outlines the responsibility for establishing those laboratory and diagnostic tests that are determined to be critical and require prompt notification to the provider responsible for the clinical care of the patient. All right, so there is a critical value and there's abnormal results. So critical value it represents a pathophysiological state at such variance with normal, it's out of the normal range, and it's determined to be life-threatening unless something is done promptly, for which some corrective action should be taken. Yeah. And then you get abnormal results. So it says significantly abnormal results. This is not life-threatening like the critical value, but it can result in, the patient increase morbidity or irreversible harm or mortality. They require medical attention and they require follow-up action within a medically justified time scale, for which timing is not as crucial as the critical results. All right, so what are the types of critical values? Okay, so they have, and this is mainly also again with the laboratory as such. Okay, there is repeated critical results. This is like where, a test was done, there was a result, it was out of the normal range, and then it gets repeated and it gets, compared with the previous value. The physician is aware of that previous value, and then from there, the clinical judgment is determined based on the patient's status. Determine if the results are to be communicated to the physician as a critical result. So this is all like from a lab point of view. There is expected known critical results. Okay, this is based on where the patient is at the moment or the patient's diagnosis. And then you get a new critical value. Okay, so that's the expected critical results or the known values. Okay, so these are the different types of critical values, right? So this is more with laboratory. All right, so what the critical test results include, right? Yeah, so there are pathology lab tests, okay, and there are diagnostic tests, including point of care testing. So we don't do much of point of care testing down here in radiology. If we had this portable creatinine machine where we were doing creatinine on site, say for example in CT, that we call point of care testing, or like, doing blood sugar tests, like, on site. So what are the actions that need to be performed when encountering critical values? All right, so the results from the critical tests and critical results will be verified in the lab to rule out if there was any errors in the sample collection and handling. All right, so this is just to know the processes that go on when a critical result is identified, So what they would do is they're going to check the quality, control of the machines, whether everything is all right, or they may like repeat the tests on another one of their equipment, just to make sure and see, rule out that, whether it's, correct or not. And also they check the patient's cumulative results for repeat critical values. All right, so then we go to how to communicate critical test results. All right, and so what happens is the critical result shall be communicated to the responsible licensed caregiver. That's the physician who requested the test. Okay, then, yeah, this is what we need to take note of here, even for us down here in radiology, because this is the process that's going to happen. So when a radiologist is reporting, an examination, either CT, MRI, whatever, and finds there's a critical finding, so the radiologist is going to pick up the phone and call the referring physician. So they should be having all the doctor's numbers available at the desk side for them to okay, this is a step that will be taken here down here in radiology. And and then it says here, even for the lab, at the same time, an SMS will be sent to the ordering physician. So this is a process that's going to be happening here when it comes to critical tests and results. Then the result will also be flagged in the system and will be visible to the caregivers. Right? So this we need to take note of. So this is, what will happen here. So when our radiologist is they're going to report their critical finding. That's the first action they're going to take. Report the finding to the doctor, then go back to the report, and then they're going to document that some information that this was stat. Okay, so these guidelines are still being reviewed here to have it in place for all and standardized for all the radiologists to follow, how it's going to be. So probably they're going to be reporting the date, the time, the name to whom the report has been given, the way it's been given by telephone. So this is going to be documented in the report. So with lab, there are forms in the DMS where critical results are recorded, but for the reports, diagnostic reports of critical, there's nothing on the DMS. But if we need to track it, we could, because it's going to be flagged on the system. So if we needed to audit that, we can check, or have some kind of monitoring of the critical results. Okay, so in the event that the ordering physician cannot be reached and does not respond to a call or page, then the call will be repeated in 15 minutes. Okay, so this is what we need to know. All right. Okay, so then, if the patient's responsible caregiver is not available within the time frames, to whom shall the report be given to? All right, so if the doctor is not available, then the information will be referred to the next responsible doctor, to an alternate responsible caregiver. All right, so this is going to be the chain of command that's going to be followed in the center. Okay, so for the inpatient, all right, there's working hours. Within the working hours, these are the responsible physicians that are going to be attending, that results can be reported to. And then you have the after hours working times, who's the responsible person to call. Okay, so this is what will be followed here in the center for the outpatients. Okay, these are the people to report to. Okay, with the reporting of anything critical. There's something here for daycare unit and for surgical endoscopy day unit. All right, and also for ICU, HDU, if there's any critical results to be important. This is the channel, the chain of command. okay, the channels to go through to report the critical results. All right, so lastly, how can we ensure accurate verbal and telephonic communication for diagnostic test results? Okay, and then as we discussed, the two patient identifiers is going to be used, right? And the receiver and the staff shall, okay, do the readback of the information, which we discussed when we spoke about telephone verbal orders. So the results is going to be conveyed to the doctor. The doctor is going to read it back and confirm, all right? And then this is going to be documented, yeah, in the HIS. Eventually, yeah, whatever it's going to, at the end of it, everything should be documented in HIS. So you have the patient name, the MRN number, the name of the test. Okay, like we said, the radiologist is going to be putting this into the report. Then the result is going to be put in. And then, yeah, immediately document it in the HIS, the patient's chart or the progress notes. And it should include the following information. All right, the ID number of the staff reporting the result, the name of the test, the name of the test, the critical test result, the ID number of the staff receiving the result, the date and time of notification, signature and stamp. Yeah, and the person providing the result will confirm the information was read back. All right, yeah, so all these processes, this is what the processes they need to follow when it comes to the reporting of critical results. And so we have our policy on the turnaround times for radiology. It's available on the DMS for our department, where you'd see the time frames for the reporting of stat examinations, routine and normal outpatient exams. And also, like, we need to have our set guidelines and protocols in place for the reporting of critical results, which has to be like, agreed on by all our radiologists and our HOD. So yeah, so basically that's it with patient safety goal number 5. Okay, the reporting of critical results. And so we've gone through, I think, yeah, that's it for our international patient safety goals. And what I could do in the next upcoming talk is put all the goals together, and just discuss, just to highlight the main things that, we need to keep in mind here, especially for radiology. And guys, I hope you feel these video lectures to be useful. But when things get back to normal, we'll move our lectures to the radiology conference room. We've got more lectures coming up on MRI safety, and we're going to be talking about contrast media policy. So yeah, that's it for now. All right, until then, thank you very much for listening. Bye.